Hey, the question today is it safe for children and babies to be adjusted? When you think about an adult spine, chiropractors are trained to adjust specifically, locate and detect subluxations, adjust to restore function in the spine and the nervous system. But an adult spine is much different from an infant or a child's spine. And so today I wanted to go over a couple things. A lot of people, a lot of patients, a lot of families come in and they ask, is it safe to adjust babies? And a lot of people are really shocked and surprised when they see so many kids coming in. There's a large percentage of our patients that come into our office are babies and kids and families. So, but when they start seeing these families getting adjusted and how easy it is, because it's a lot different technique to adjust a baby and a newborn than it is an adult. So just like people who specialize in chiropractic with children and babies, they do extra training to really identify the movement and the health of a newborn and a baby compared to an adult. So you definitely want to find someone that has had extra training with that and has had a lot of experience. Is something I would recommend. But the reasoning why behind that is, well, first off, to adjust a baby, we're evaluating the health and the movement of the spine, the sacrum, and then even these little tiny bones up here in the top of the neck. And what's real common is the birthing process alone. Dr. Gutman from Harvard has shown that 80% of babies are actually from the birthing process is causing trauma and stress to the upper cervical and the neck. And so there's lots of pound and pulling and torquing on these babies many times. Unfortunately, there's a lot of stress that can occur from the birth process. So, and here when we go to correct the problem, once we identify there's been stress and trauma done and things are not moving properly, then just a few ounces of pressure, like pushing a keyboard down, or the amount of pressure that can comfortably put pressure on an eyelid. Or another example is as a ripe tomato, putting some pressure to check to see if a ripe tomato, without pushing your finger through, is the amount of pressure needed to just slightly move the bone and allow that to move freely without any inhibition, allowing the brain to send those signals through there. So allow the child to flourish rather than, unfortunately, if this is gone uncorrected, whether it's the neck, the back, or learning how to walk, landing on the tailbone, these things can happen, causing this subluxation where the spine shifts, causing damage to those nerves. And if that's not corrected over time, it starts causing damage to the discs, the spinal bones, the joints. It can cause inflammation. And then, of course, as you probably know, the nerves that come out of the spine control all the organs and glands. So that's why you see a lot of babies coming in with colic or ear infections and asthmas. And it's amazing to me is how many babies get put on medication for reflux and indigestion, and they're throwing up and all these things. And many a times we've had babies coming in and the problem was a restriction in the spine, not allowing the nerves, the brain to communicate, so the digestive system wasn't working right, and the child was in discomfort or pain, or they weren't able to extract the bowels properly. But it's all about just healthy spine, getting things to move right with small amounts of pressure and to realign the little tiny bones, and to allow that precious nerve signal and strength to run through the body optimally. So if you ever have any questions, feel free to reach out. Just remember, you're stronger, healthier, and happier with Hill Family Chiropractic. I'm Dr. Hill. Hopefully this is some helpful information for you. Thank you.